everyone, it's good to have you joining us again on another episode of the program Clinicology, coming to you from the studios of the New Frontiers Television. And my name is Temitope Oladipo. In case you are tuning in for the first time, this is our health program, a platform where we discuss health-related issues and first aid tips. So I want to say you are welcome on board, just in case you are tuning in for the first time on this station. Fortnight ago, we promised that we are going to bring an expert to discuss a particular topic, and that is pre-eclampsia. But before we go into that, last week, precisely May 17, it was World Hypertension Day. World Hypertension Day. It was a day created by World Hypertension League in 2005. The day is intended to increase the awareness of the condition and issues surrounding it. Awareness of hypertension is considered to be vitally important due to the number of deaths linked with associated heart attack, kidney disease, and stroke. That was precisely May 17. It was World Hypertension Day. And the theme for this year World Hypertension Day is Know Your Blood Pressure. In our quest to know what our Nigerians often check their blood pressure, we spoke with few Nigerians. Let's see their reactions. We'll be back. Also known as hypertension. Blood pressure is the amount of force exerted against the walls of the arteries as blood flows through them. If a person has high blood pressure, it means that the walls of the arteries are receiving too much pressure repeatedly. The pressure needs to be chronically elevated for a diagnosis of hypertension to be confirmed. In medicine, chronic means for a sustained period and persistent. If left untreated or uncontrolled, high blood pressure can cause many health problems. These conditions include heart failure, vision loss, stroke, and kidney disease. Mrs. Olatokun Oluwatosin, an occupational nurse, explained further on this.
High blood pressure can simply be defined as a persistent increase or rise in the level of blood in the body. That's a simple definition. And blood pressure, it has a range in the body. It ranges between 90-60 milligram of mercury to 140-90 milligram of mercury. But there are some schools of thought that makes it vary. But generally, the normal range is between 90-60 to 140-90.
A retired reproductive medicine consultant at the University College Hospital UCH Ibadan, Professor Modupe Onodeko, says 7 out of 10 Nigerians have hypertension and that 50% of these 7 are unaware that they are hypertensive. Professor Onodeko disclosed this on Wednesday in an interview with newsmen in Ibadan in commemoration of this year's World Hypertension Day. The commemoration is aimed at increasing public awareness about the condition, and this year's theme is Know Your Blood Pressure. Our crew went out to know how Nigerians do often check their blood pressure.
Of my health, so I do check it at least once in a week, so to ascertain, and because of the type of job I'm doing, I'm a marketer, and because of the stress and the target that is given unto me, this is always pose a kind of a stress on my health. So, and it lead me to check it at least once in a week, especially on Saturday. To that will, help me to prepare for the week ahead. My advice generally to everybody is to make it a kind of a perpetual thing. If we look at the situation in the country, the recession is also the result is depression, and if one cannot take it easy, it will lead to high blood pressure. So I want to say it, I don't have that statistic, but I know an average Nigeria, we are living on high blood pressure.
Go for medical checkup and check all my body system, especially my BP. BP is the same thing as the blood pressure. I check it from time to time. I have the machine at home, just a little machine for me to check, and there is an instruction on it that I follow from time to time. My advice to our people is checking the blood pressure should not be a crime and should not be a thing that will make them to get too much afraid of doing it. It's a thing you should do from time to time so as for you to know how to take care of yourself and to manage yourself well.
Actually, for me, I check it once in 2 months because my doctor where I work, she advised me to be checking it once in 2 months. That's why I check it once in 2 months, and I'm okay with it. Ma? Well, I want to advise people because when we look at what is going on around the world now, because of the money and so many things, people are sick and there is so many things happen to people. So I will advise people to be checking it at least once in 3 months or 2 months and make any checkup every time because of our condition these days.
I go to the hospital before I check my blood pressure. You say what? My advice to people is that they should try to be checking their blood pressure at least 3 months so that they will know if there's something wrong with their health-wise. Yeah.
As we mark this year World Hypertension Day, it is advised that people should do regular blood pressure check and adhere to doctor's instruction on healthy diet and physical exercise. Temitope Oladipo reporting for New Frontiers Television. Glad to have you back on the program, Clinicology. Of course, you've listened to what Nigerians have to say about how often they do check their high blood pressure. I have a guest on the show today, and she is an occupational nurse. I have Mrs. Olatokun Oluwatosin on the show today with me. Good to have you on the program.
Thank you, ma.
Thank you so much. We've listened to what Nigerians have to say as regards their high blood pressure. How often do they check it? Some people say they do check it twice in 3 months, twice in 2 months, and someone said that it's only when he or she comes down with sickness and he or she visited the hospital, that is when they do check it. Now, I want to ask you, how often do you think medically people should be checking their blood pressure?
Thank you. Actually, it depends on individual. It depends on their health status. If at the first check they found it to be normal and there is no underlying problem like health history of one family or the other, then they can check it once, let's say approximately thrice in a year. But as far as they notice any change in their body, they should go to the hospital, check it and do other necessary checkups. But for people that has high blood pressure, they should check it at least once in 2 weeks. But within the space of these 2 weeks, if they feel any change in their body, probably insomnia, which is lack of sleep, or any physical change, it is good that they go to the hospital. But generally, once in 2 weeks for people that has hypertension.
Okay. So when the high blood pressure is extremely high, let me just put it that way, is it likely that it comes to normal? As in, what are the measures to put in place for it to come back to normal?
Yes, it's possible with the aid of the management. For instance, their diet is important. They will be placed on certain diets that will help their blood pressure to become normal, and also their medications. They will also take some medications that will help their blood vessels to work normally and their blood pressure will come to the normal. And also there are certain exercise that they can be doing that will also facilitate this to come to the normal rates.
Okay, so if left untreated, if left unchecked, what are the consequences that comes with this?
There are so many consequences. It could lead to so many other diseases like kidney disease, liver disease, heart attack, stroke, and it could also lead to instant death.
Oh, okay, when it is left untreated or left unchecked.
Yes.
Okay, so medically now, let's say it's advisable that if you have high blood pressure twice in a week or twice in 2 weeks, you should be checking it,
exactly.
Right? But if someone doesn't have it at all, let's say someone doesn't even have it at all, but medically it's advisable to check like?
To check it like once in 3 months, which makes 4 times in a year.
Oh, okay, thank you so much for that brief explanation on high blood pressure. Unfortunately for us this morning, our topic for today also has something to do with what we've just discussed, and that is high blood pressure. Today we'll be talking about pre-eclampsia. Pre-eclampsia, like we told you a fortnight ago, that we'll be bringing an expert on the show who is going to talk exclusively on that topic, and I'm glad that she is here to talk on pre-eclampsia today. Now let me quickly ask you, what exactly is pre-eclampsia?
Pre-eclampsia is simply defined as a term which is used in stages of pregnancy. Is one of the things that happens in pregnancy which is abnormal. It involves high blood pressure and also high urine, which is called proteinuria, and also edema. Pre-eclampsia happens in pregnancy when all these things are in place. I mean, when there is high blood pressure, when there is proteinuria, and when there is edema. And if it's not well managed or treated, it could lead to eclampsia, which is associated with fits, or what people usually call, the medical term is fits. We call it convulsion. Some people term it as convulsion. So this pre-eclampsia could lead to eclampsia when it's not well managed.
Okay, now before we go on other things about pre-eclampsia, you said that it's a kind of thing that occurs in pregnancy.
Yes.
Does that mean that the woman has an history of high blood pressure before she got pregnant?
In some cases, the woman might have an history of high blood pressure, and in some cases, the woman might not have it. There are some people that usually have high blood pressure during pregnancy alone. Okay. And immediately they put to bed, the whole thing will disappear.
Okay, so let's say that pre-eclampsia just occur in pregnancy.
Yes.
It doesn't mean that maybe the woman has an history of high blood pressure before she got pregnant.
It doesn't mean, but it could be.
Oh, okay,
Yes.
okay. Now, what are the symptoms that pregnant women could look out for that will pinpoint to them that this is pre-eclampsia?
Thank you. Part of the symptoms is one, like I've mentioned, high blood pressure. This is why it is important that they go for a medical checkup during pregnancy. They register on time so that they will be well monitored. Their blood pressure will shoot up. This is one of the cardinal signs of pre-eclampsia. There will be excessive urine. There will be excessive protein in their urine, which is called proteinuria, and there will also be edema. Oedematous of the hands, of the foot, of the body.
What does that mean, edema?
This means excessive fluid in certain parts of the body, which will be swollen, that one can see physically. Okay. All their body parts will be swollen, their eyelid, and all those kind of things. Then also there are other signs which are not the cardinal signs, like abdominal pain, especially at the upper right quadrant of the abdomen. There will be severe abdominal pain. There will be severe headache. They won't be able to sleep well, and they have the tendency of gaining weight excessively. Within 2 days, they can gain so much weight that it will be so glaring. And also, there are also so many other things that happen that we could liken to other diseases, like vomiting, like fever, a loss of appetite. But even with the loss of appetite, they tend to gain more weight.
Okay, now you've mentioned like symptoms of like vomiting, loss of appetite.
Yes.
But I want to believe that these symptoms you mentioned are also part of symptoms of pregnancy.
Exactly.
Even when the woman doesn't have a pre-eclampsia.
Yes, that was why I mentioned the cardinal signs first, which are the protein in the urine, edema, and high blood pressure, then abdominal pain. Okay,
you explained the edema to be too much of fluid.
Excessive fluid.
Yes. Now, does that imply the reason why some pregnant women do come down with swollen feet?
Yes, it could be part, but it doesn't really mean that they have pre-eclampsia until a test is done to verify that.
Now, if I may ask you, when we see a pregnant woman that just got pregnant for like 6 months pregnant or more than that, or even lesser than that, and you see them coming up with swollen feet, what do you think is responsible for this? At times they say that it's normal, but at times they say that, oh, it could be some reason for, it could be some complications.
Okay, majorly, there are some that comes up with this due to stress, due to the nature of their job. And there are some that comes up with it even without stress. If they go for a medical test, they really find out what has caused it. It could be as a result of high protein in their body or hypertension. most people that comes up with pre-eclampsia usually have it towards the 36 weeks of their pregnancy. It's towards the late time of pregnancy that normally come up with pre-eclampsia.
So who do you think is at risk or could be prone to pre-eclampsia?
Generally, teenagers are at risk. Teenage pregnancy predisposes one to having pre-eclampsia, and also having been pregnant at over age 40 could also predispose one to having pre-eclampsia. And also usually at the first pregnancy one could have it. I mean the very first pregnancy, not even minding the age.
So but you said that when someone is over 40, and by the time the person is carrying a baby
with the first baby,
when the person is over 40 years, what is the medical explanation to this? Is it because the body are getting weak, or?
Yes, it's possible. Actually, it has not really been established, because there is no major cause that we can say that causes pre-eclampsia. But generally, there are some genes that will be deposited in the body abnormally with age. You know, with age, degenerative processes will have commenced, and anything unpredictable can happen, which is part of this topic we are treating, pre-eclampsia.
Now, if I may ask you now, fine, pregnant women have been advised to go for antenatal clinic.
Yes.
Get your BP done and other things necessary for every pregnant woman. But what would you say should be the normal blood pressure for every woman? Let's leave the pregnancy out of it.
For every woman. It should be between 90-70 millimeter of mercury to 120 millimeter of mercury. If it's tending towards 130-140, it is not abnormal, but certain precautions should be taken at this stage. But generally and very normal, 90-60 to 120-80 is very normal.
And for the pregnant women?
For the pregnant women, you know, during pregnancy, the normal thing is that the BP comes down because there is a peripheral dilatation in the blood vessels that makes blood flow very easily during pregnancy. So this warrants the reason why the BP should come down to something like 170, 90-60. In fact, some people could be as low as 80-60. Though it shouldn't be too low. But generally, 90-60, 170 is okay for a pregnant mother.
Now for some women, let's say pregnant women, that you said the first pregnancy, that it could expose the woman to eclampsia. So what happened to the subsequent pregnancy? Does that mean that since it is just the first, so it won't happen for the second pregnancy, it won't happen for the third pregnancy?
There is something about it. Once the person has had it in the first pregnancy, it means the person has an history of it. So it's possible the person has it in subsequent pregnancy. Now we are talking, that means pre-eclampsia basically occurs in pregnancy. So if you say it occurs in pregnancy, I want to believe it's going to have some side effects on the mother and on the pregnant woman. So what are the risks that pre-eclampsia puts every pregnant woman to? Number one, there could be excessive bleeding. And also there could be difficulty, and there could be clotting disorder, in which blood will find it so difficult to stop, to clot together, to stay where it's supposed to stay. This is one. Number
bleeding during pregnancy or bleeding
after birth.
After birth,
yes. Also, it will predispose them to other disease conditions like kidney problem, heart attack. And during pre-eclampsia, during the eclampsia stage, if proper care is not taken, it could lead to stroke, because there will be insufficient blood flow to the brain, which will lead to stroke for the mothers.
For the mother.
And also for the babies, it could lead to deficient birth weight. There will be low birth weight because they will not have adequate nutrition, adequate blood supply. So it will lead to reduced birth weight. It could lead to the mother giving birth to the baby prematurely, preterm baby. And there could also be detachment between the placenta and the uterus. And in the extreme, it could lead to deaths. Also, amongst the amidst the effects on the baby, there could be oligohydramnios, in which there will be decreased fluid in the womb. There is one thing we call amniotic fluid, where the baby survives, the fluid will reduce, and this will predispose the baby to other diseases, other abnormality.
Okay.
Yes.
Now, the normal high blood pressure, let's forget about pre-eclampsia now. Just like the reports we heard, some people say, it's because of what is happening in the country. There is no money, the country is in a recession, the economy is bad, and other things. That if you keep thinking about all these things, it's possible for you to have high blood pressure. Yes. Now, let's talk about the pregnant woman. I wonder what they are thinking about. I wonder what could have made a pregnant woman to be depressed. So why do you think pregnant women do come down with high blood pressure?
Generally, it is not really because they think a lot. Some people doesn't even think at all, and they will have it. There's something that predisposes one to having hypertension. I mean, even pregnant women, like family history. Let's even forget about economic situation or things like that. That is not enough reason for someone to develop hypertension. It depends if there is any underlying.
It's not enough reason. When you listen to those people that say, if you are thinking about the country and other things like that, yes, someone will just have well, that's a layman explanation.
That is layman explanation. It depends. It is when they now take it too much upon themselves that they are unable to sleep, they are unable to do the normal exercise they should do, they are done with it. This is when other diseases can come in, and which could also lead to having high blood pressure.
Okay.
But there are some other factors like family history, obesity.
It's hereditary, right?
Is hereditary. High blood pressure is hereditary.
Okay.
Yes, and pre-eclampsia too could be hereditary. It could be.
Okay.
And other factors like that too could also lead to a pregnant mother, a pregnant woman having high blood pressure.
Okay. So
but generally, there is no particular cause. It's just predisposing factors that we've been able to gather. Researchers has not gotten any particular cause that makes one prone to pre-eclampsia.
Okay. I'll be having this an educative moment with Mrs. Olatokun Oluwatosin, and the topic we are treating this morning today is pre-eclampsia. We've talked about what pre-eclampsia is, what are the symptoms, and what are the risks it's put on the mother, and the pregnant woman, and the baby. We quickly take a short break now, and when we be back, we'll continue with the show. Please stay with us.
Pre-eclampsia is a disorder that only happens in pregnant women, and it happens after 20 weeks gestation, and in some cases develops up to 6 weeks after delivery. Pre-eclampsia causes new onset hypertension and proteinuria, which is a marker of kidney damage, and can also cause damage to other organs like the brain and the liver. There can be a wide range of symptoms. For some women there might be no symptoms or only mild ones, whereas for others it can turn into a life-threatening illness. If a woman with pre-eclampsia develops seizures, she's then said to have eclampsia. Pre-eclampsia tends to happen more often during a first pregnancy, in pregnancies with multiple gestations, or in mothers 35 years or older. Other risk factors include having hypertension, diabetes, obesity, or a family history of pre-eclampsia. Alright, but why do these changes happen in pre-eclampsia and eclampsia? Well, the exact cause is unclear, but a key pathophysiologic feature is the development of an abnormal placenta. Normally, during pregnancy, the spiral arteries dilate to 5 to 10 times their normal size and develop into large uteroplacental arteries that can deliver large quantities of blood to the developing fetus. In preeclampsia, these uteroplacental arteries become fibrous, causing them to narrow, which means less blood gets to the placenta. A poorly perfused placenta can lead to intrauterine growth restriction and even fetal death in severe cases. This hypoperfused placenta starts releasing pro-inflammatory proteins. These then get into the mother's circulation and cause the endothelial cells that line her blood vessels to become dysfunctional. Endothelial cell dysfunction causes vasoconstriction, or narrowing of the blood vessels, and also affects the kidneys in a way that makes them retain more salt, both of which results in hypertension. When diagnosing preeclampsia, Hypertension is defined as a systolic blood pressure of 140 millimeters of mercury or greater, or diastolic blood pressure of 90 millimeters of mercury or greater. In severe preeclampsia, systolic blood pressure can be 160 millimeters of mercury or greater, and diastolic pressure can be 110 millimeters of mercury or greater. These extreme blood pressures can lead to a hemorrhagic stroke or placental abruption, which is when the placenta detaches prematurely from the uterine wall. Now, there can also be local areas of vasospasm, which means that less blood might reach certain parts of the body. For example, reduced blood flow to the kidneys, which are particularly susceptible, can cause glomerular damage, leading to oliguria, which is abnormally low amounts of urine, as well as proteinuria. Normally, the glomeruli of the kidney do a pretty good job of preventing protein from spilling into the urine. So proteinuria can be a sign of glomerular damage, and is classically seen in preeclampsia. Reduced blood flow to the retina can cause blurred vision, the sensation of seeing flashing lights, and the development of a scotoma. A scotoma is when a small part of the visual field has slightly worse visual acuity, which is kind of like having a blurry spot on your computer monitor. Reduced blood flow to the liver can cause severe liver injury and swelling, which can cause an elevation in liver enzymes and stretches out the capsule around the liver. Stretching of the liver capsule typically causes right upper quadrant pain, or epigastric pain, which is one of the cardinal symptoms of severe preeclampsia. Endothelial cell injury also leads to the formation of lots of tiny thrombi in the microvasculature, which is a process that uses up massive amounts of platelets. Having all these tiny blood clots in the blood is a little like having dozens of boulders in the middle of a fast-moving river. It becomes treacherous for red blood cells to navigate through, and before long they slam up against a clot and get destroyed, which is a process called hemolysis. Together, these make up the HELP syndrome, H for hemolysis, EL for elevated liver enzymes, and LP for low platelets. HELP syndrome develops in about 10 to 20% of women with severe preeclampsia or eclampsia. Finally, endothelial injury increases vascular permeability, which is when water is allowed to slip out of blood vessels between neighboring endothelial cells and get into the tissues. Because there's also a loss of protein from the blood due to the proteinuria, even more fluid moves from the blood vessels into the tissues. And this causes generalized edema, which is often seen in the legs, the face, and the hands, pulmonary edema, which can cause cough and shortness of breath, and cerebral edema, which can cause headache, confusion, and seizures. And these seizures are what define the onset of eclampsia. Because all the problems of preeclampsia and eclampsia stem from placental dysfunction, the ultimate treatment is delivery of the fetus and placenta. The decision to induce delivery depends heavily on the gestational age of the fetus, as well as the severity of the disease and how it's affecting both maternal and fetal health. If the onset of symptoms comes after delivery, then the goal is to manage the symptoms, which slowly subside on their own. Additional measures are aimed at managing any end organ damage by offering supplemental oxygen, as well as medication to manage seizures and other complications like stroke or placental abruption. Alright, as a quick recap, preeclampsia is a disorder that happens after 20 weeks gestation and up to 6 weeks following delivery. It's defined by a new onset of hypertension and proteinuria, but can affect a lot of organs, particularly the kidneys, eyes, liver, and brain. Eclampsia is diagnosed when a patient with preeclampsia develops seizures. Thanks for watching. You can help support us by donating on Patreon.
Good to know you are still there with us on the program Clinicology, coming to you from New Frontiers Television. And we've been talking about preeclampsia. I still have with me Mrs. Olatokun in the studio today. And before we went on that break, we've talked about what preeclampsia is, what are the symptoms, and what are the risk factors of preeclampsia. Now we quickly want to look at, like they do say that prevention is better than cure. What are the preventive measures to put in place?
Thank you. Number one, there is need for a prompt medical checkup, a routine medical checkup.
Okay.
And during this checkup, the BP will be checked. There will be urinalysis done, which will tell if there is protein in the urine or any other abnormalities. Then the blood test will also be done. And all this, when done, it could tell if there is any underlying problem so that it will be well treated. This is what we term as the prevention, because once it happens, there is no treatment for it.
Okay. Now everybody know that pre means before.
Yes.
We talk about pre-eclampsia, and we also have eclampsia.
Yes.
So let's quickly talk about the difference between the two.
Okay. Pre-eclampsia is the state that comes up before the eclampsia. The eclampsia state is associated with the seizure, or what some people term as fits. That is when eclampsia comes up. Then eclampsia comes up when the pre-eclampsia stage is not well managed. When it is so severe, then eclampsia will come up. But it is possible someone has pre-eclampsia without having eclampsia if the person is well managed, if the person could report to the hospital at the very good time at the beginning. But when it is poorly managed, then it will go into the stage of eclampsia, which is when the pregnant woman will start throwing fits, will start having seizures.
Okay, that's just the difference between the two.
Yes.
Now eclampsia, that means that is when it is not well managed,
Yes.
not well treated.
Yes.
Now, what are the treatments for pre-eclampsia so that it won't come to eclampsia?
Okay. Number one, when the person reports to the hospital, the person will be placed on bed rest. The person could be given drugs that will help in bringing down the blood pressure. Also, the person will be placed on some special diets that will help the blood pressure not to shoot up. Also, there are other things that will be done, like urinalysis, trying to make the urine okay in order that there won't be protein in the urine. And also part of the treatment is that if there is no improvement, it depends on the time of the baby. The person could be advised to do cesarean section, so that the baby and the mother will be safe. Okay. These are part of the treatments.
Now, before that break, you said something about a pregnant woman that has pre-eclampsia could have premature baby.
Yes.
That she could deliver prematurely.
Yes.
So, if the baby is being delivered prematurely, does that mean the growth will be affected?
If the baby is being delivered prematurely, there are certain care that will be given in the hospital, like putting the baby inside an incubator. And with this, the baby will grow well, and even in the future, no one will know that this baby was born prematurely.
Okay.
But if there is no adequate care, then the baby will be malnourished. The baby will have a very small growth and unpleasant growth. But when all things are being done perfectly, the baby will be okay.
So the baby will grow just like the
normal
baby
with good care.
Okay. Now, how is it being diagnosed?
Thank you. You can diagnose this, like I said earlier, by prompt reports to the hospital. The blood pressure will be checked, number one. The urine will be checked for protein in the urine and all other things that need to be checked in the urine, like glucose and other things. And also, blood tests will be done to know the platelet level, because in pre-eclampsia, there is usually reduced platelet level, which leads to disorder in clotting, like I said earlier. So all these blood tests will be done. These are the things that can be used to diagnose. And other health history also will be asked to know if it is hereditary, to know if the person has the kind of disease in the body that has prompted pre-eclampsia to occur. Also, a sickle cell patient is most likely to have pre-eclampsia. So during the diagnosis, they will know and proper treatment to be given.
Sickle cell?
Yes.
So why is that so?
It is so because, in sickle cell patients, so many things go wrong in their system. Okay. In which there is, for instance, they normally comes up with arthritis. That is the inflammation of the joints. And also in sickle cell, there are abnormal genes that are being deposited in their body. And these are part of the things that could predispose one to having pre-eclampsia. And there are also so many changes that happens in their body, that like the breaking down of red blood cells in their body. In normal person is between, I'm not saying they are not normal, but in someone that is not a sickle cell patient, it happens between 100 to 120 days. And theirs is like, I think 10 to 20 something days. Can you see the difference of the breaking down of the red blood cells? So many things happened in their systems that could predispose them to having pre-eclampsia.
Okay.
So adequate care must be taken to avert this.
Okay, now let me just ask this. In your years of experience as a medical personnel, now we've seen sickle cell people that do get pregnant.
Yes.
Are there any special treatments? Are there any special antenatal treatment for them?
There is. In fact, there are very special ones. Number one, in terms of their red blood cell, normally they usually have early destruction of red blood cells. And during pregnancy, the baby also will need to use the mother's erythrocytes to also live. So they need more essential diets than people that doesn't have sickle cell. They need to be on bed rest.
Throughout the pregnancy?
Not throughout. Okay. It depends on how. There are some sickle cell patients that are so healthy that you really know that they are sickle cell.
So it depends on the severity.
On the severity. Okay. But they need to take so many precautions, like their diet, their health monitoring, their medications, and all other things needs to be well managed.
And they can also deliver normally or through cesarean section?
They can also deliver normally, but there are some places, there are some hospitals that they won't even want to take the risk at all. So they will advise that they do cesarean section.
Okay, still going back, let's really go back to a preeclampsia. Now, if a pregnant woman is having a preeclampsia, does that mean after the baby is being delivered, there is not going to be preeclampsia again?
Actually, there are some cases that when preeclampsia happens before pregnancy, after pregnancy, they can still go to the eclampsia stage if it is not well managed. And there are some people that can even go to this pre-eclampsia stage like between the 1st and 6 weeks of giving birth, after birth. So it is possible for someone to still have pre-eclampsia or eclampsia after birth, and this should be between 1 to 6 weeks after birth.
Okay, so that means it's in two ways.
Yes.
After birth, it is possible that there is no sign of preeclampsia.
Yes.
And after birth too, it could still remain.
Yes.
Or it could even lead to eclampsia.
Exactly.
Okay, so what are the things that they should do just to avert the two?
Generally, there is no major thing that could be done. But okay, when this is seen, or when this could be sensed that it might happen, they will be on bed rest. So that whatever that is going to happen, at least the severity will be reduced when on bed rest. Okay. They will watch out for other symptoms like swelling of the feet. Like if there is still swelling of the feet, they will know that of course this could still happen. So they will be on bed rest. They will be on special diets. Okay. They will be on some medications that could at least avert it or reduce the effects.
Okay, I've seen some cases that even after birth, you still see the woman coming down with high blood pressure.
Yes.
Because I remember some of the postnatal clinic,
okay,
and they were about to start this family planning lecture. Okay. So they first check the high blood pressure. The moment they say that the person is having high blood pressure, there's a particular one they won't administer on her. So why is it that even after birth, that we believe that everything should come back to normal, you still see some women still coming down with high blood pressure?
If a woman has high blood pressure in pregnancy, this should fade away within the 1st to 6 weeks after birth. But if this persists, it means probably the woman has had the history even before the pregnancy. So certain medications will be given even after birth, after the 6 weeks of birth, to reduce this. But it is certainly because there is an underlying problem even before the pregnancy.
So what could that be? What could those underlying problems be?
It could be as a result of hereditary factor, okay, as a result of improper diet, as a result of obesity, lifestyle, alcoholism intake, smoking, and other causes of hypertension.
Okay, so generally, let's just talk to women, pregnant women. Now, you said something just now about lifestyle. So what do you think medically should be the lifestyle of every pregnant woman?
Number one, they should watch what they eat, because we are what we eat, like an adage says. That is number one. Then in pregnancy, one shouldn't just take any medications. Anything you should take must be according to the advice of your medical experts, of your doctors. You shouldn't take any medications on your own, like, oh, one is having a headache, let me just swallow paracetamol. It is wrong. Or you don't take any drugs out of the prescription. That's number one. Number two, we need to take caution of the diet we eat. There are certain food, there are certain nutrients that we need at that time of pregnancy. So these are the things that we should also take. And also radiation, exposure to radiation should be eradicated. Okay. It is not good for a pregnant woman to expose herself to radiation. And also excessive stress is not good for a pregnant mother. Smoking, alcoholic intake is not good for a pregnant mother.
Okay. Now let's talk about the prognosis for preeclampsia. What are they going to be the outcome? Okay. When the prognosis for preeclampsia, if it is well managed, it is safe. There won't be any problem. But if it's not well managed, then it becomes a medical emergency, which could lead to eclampsia. And generally, we have about 2% mortality rates of pre-eclampsia. Like when people have it, there are certainty of losing their life, losing the baby, or even losing their lives if it is not well managed. So 2%. Then let's say preeclampsia is responsible for 2% of mortality rates.
Yes, in pregnancy.
So what are the other factors responsible? Because I want to believe that even this preeclampsia, the statistic might increase if it's not well managed. So what are the other possible factors that you think could be responsible for the increased rate of mortality in our society?
Number one, improper care. It can lead to heat, misuse of drugs, exposure to radiation, misuse of drugs. If a pregnant woman should use any drug that is not to be used, it could cause, within a second, it could cause the person alive. Then also, the kind of diet, a stressful life, nonchalant attitude to medical care, and even the people that would treat. That some people believe that I don't want to go to the hospital, their injury is too much, so they will go into the wrong hand, and so many things will be mismanaged. Improper health facilities, all this could lead to mortality rates in pregnancy.
Okay. Now before I let you go now, what will you say to women that are preparing to get pregnant? Because I believe that if we are saying that preeclampsia occurs in pregnancy, what are the lifestyle they should engage in just to avoid or to prevent preeclampsia?
Thank you. My advice for pregnant women is that once they know they are pregnant, it is good they go to the hospital and register with a standard hospital, not just anyone, in a standard hospital. Certain things they will be doing will be told, so they should follow any guidelines. And also their diet is important as well. They need to rest well. There are some medications pregnant women should take, which are daily pills. For example, I don't know if I can mention medications. For example, like folic acid, and other normal routine medications they can also use. They shouldn't go outside this. But if you notice that there is a change in your body, there are changes, please go to the hospital, go to where you have registered in, and make sure that wherever you are registering in shouldn't be far from your house, so that in case of anything, you can easily go there and report.
Yeah, Ms. Olatoko, something just dropped on my mind now when you were responding to that question. Sometime I heard it's a myth. Don't let me say it's a fact, because I don't know how far it is true that malaria in pregnancy could also be responsible for preeclampsia.
Malaria, no. It is not part of it, but malaria in pregnancy could be responsible for mortality rates in pregnant women.
So is it normal, or is it sure it must happen? Is it a thing that must happen for every pregnant woman to come down with malaria during any course of pregnancy?
Yes, it is not that it is normal or abnormal. That is why we advocate that everyone, especially pregnant women, should sleep under insecticide mosquito nets, treated one, so that there won't be issue of mosquito bites. Once there is mosquito bites, then the person will be predisposed to having malaria. And if the malaria is not well treated, it could be complicated.
So malaria in pregnancy is also one of the causes of mortality rates.
Exactly.
So it will affect the mother and even the fetus
exactly,
inside.
yes.
Okay. So now when this happens, like the first trimester, is it likely to have any complication like miscarriages, or if it's not well managed?
It is possible, and that is why in hospitals they give pregnant women prophylactic treatment for malaria. These are medications that could be used even when you are not done with the malaria, but just to prevent it. They are preventive measures to malaria. These are prophylactic treatments. So it is important that all pregnant women take this so that they will prevent occurrence of malaria.
Okay.
Because we know that malaria is a serious thing in pregnancy.
Now, I want to believe that there are some mild exercise for pregnant women.
Yes.
So that it won't be as if, they are just sitting down, doing nothing. They need to exercise their body, get your body engaged in one activity or the other. So what are those exercises like that it won't affect their body or it won't have any complications on them?
One of the exercises they can be doing is just having a slight brisk walk at home, or even for people that are working. It depends on the nature of their job. Some people, their job is for them to sit down from morning till night. This is not good for a pregnant woman, because in no time the foot will be swollen, there will be edema, especially in the lower trunk of the body. So with this, one can just at least stand up once in a while, walk here and there, just don't remain in a place, and don't always sleep at all times. So pregnancy could make one feel as if you should be sleeping and sleeping, but try and
it doesn't mean hitting for two.
It's hitting for two. Yes, especially one that has the history of hypertension, one that has obesity, one that is obese. The diet should be well taken care of, and adequate exercise, not too much exercise.
Why is it that we always have this mentality of I have to eat for two? That because the baby is also consuming.
There's people that generally they like food, they eat a lot, and even African women, we are prone to gaining more weight excessively from where we don't even think of. So it is good what we eat. It's good we monitor what we eat, so that even after birth one won't be too big. And gaining excessive fat could also predispose one to so many other things.
Other thing that comes with this pregnancy.
Yes.
Well, I want to say a very big thank you to Mrs. Olatokun for being part of the show today. It's really been a very informative and educative time on the show today. Don't forget the topic we talked about, and that is pre-eclampsia. For every woman out there, particularly the pregnant woman, it's good and advisable medically to present yourself for antenatal clinic, so that any complications could have been overruled and it could have been sorted out before it leads to other things. Just like she's rightly said, that if pre-eclampsia is left untreated, is left untaken care of, it will lead to eclampsia, and that is the height of it. So I see the Lord helping us and taking good care of our health. Don't forget that health is wealth. So when you take care of your health, you enjoy life. So for women, everybody, pregnant women, everybody, please let's take care of us. So if you are noticing anything that you think it's strange in your body system, please present yourself on time to your hospital, and not just any hospital. A very good hospital, state hospital, federal hospital, or any private hospital that you think they are good and they know what they are doing. I want to say once again, thank you to Ms. Olatokun for coming on the show today. And don't forget that the studio line is still open for you to drop your questions, maybe on topic we treated today, or on any other topic that we must have talked about on the show. You can also drop your comments on all our social media platforms, our Facebook, or follow us on Twitter and other things that you need to ask. Please drop your question via the phone number scrolling right on your screen. I will see you again next week by God's grace. It's bye for now.